In today's show, what do dreams reveal about your health? We will explore the meanings of dreams. Did you know that about 1/3 of our lives are spent sleeping? Assuming the average lifespan is 80 years, we'll spend roughly 26 years, an astounding amount of time, sleeping. It is estimated that we dream between 3 and 6 times per night, equivalent to around 6 years of time dreaming in a lifetime. However, as soon as we wake up, we forget 95% of what we dream about. Dreams are universally described as sensory, cognitive, and emotional happenings that may occur consciously during our sleep. When we dream, we often have limited control over the experience we go through. They can be entertaining, fun, or frightening, and sometimes they just do not seem to make any sense at all. According to research, about 65% of our dreams have some kind of connection to the activities we've performed when awake. Although dreams seem to be associated with daily events, some people believe that they could carry deeper messages rather than just being a compilation of memories accumulated throughout the day. Interpretations of dreams can be quite different, depending on whether the experts analyze them from neuroscientific or psychoanalytic perspectives. Dr. Carl Jung, a famed Swiss psychiatrist, was one of the best students of Dr. Sigmund Freud, a renowned Austrian neurologist, who is also known as the founder of psychoanalysis. To many, Dr. Jung and Dr. Freud had a profound impact on the world of psychology, as their work led to the advancement of psychological treatments for a myriad of mental conditions. Although both had different ways of analyzing the relationship between dreams and the mind, their theories shared many similarities. Dr. Freud once said, "The interpretation of dreams is the royal road to a knowledge of the unconscious activities of the mind." By using an analytical approach to interpret dreams, both Dr. Freud and Dr. Jung believed that dreams reflect the unconscious mind of a person. Dr. Jung's interpretation of dreams is derived from the concept of collective unconsciousness, meaning that the human mind has universal characteristics inherited from our ancestors. Based on this theory, we can standardize and decipher symbolic images, patterns, or behaviors that appear in our dreams, and this can help us explain our daily lives and discover things about ourselves. For example, we may feel something is missing in our relationship with a loved one, but not know exactly what. Like Dr. Jung, Dr. Freud believed that one's past and childhood experiences affect our future behavior, yet he interpreted dreams in a slightly different way. He thought dreams mask unfulfilled wishes and help resolve unwanted emotions and experiences. When dreams conceal repressed desires, they are sometimes presented through bizarre images or symbols. Dr. Freud believed an expert was needed to guide an individual to make an association between their dreams and reality. He felt that this approach would help people to explore their buried desires. Before scientific theories even emerged and led to the development of psychology, people from all corners of the world have long attempted to decode the meanings and significance of dreams. Although the mechanism of dreams is not entirely understood, dreams across the globe and cultures often have many things in common. This has led many to believe that dreams carry important messages. For example, dreaming about falling can mean a sense of insecurity, whereby people feel a lack of control over their life or relationship. Dreaming about missing a train or bus can mean that unaccomplished goals in life are causing frustration. Discovering money or treasure in dreams may also signify a person's healthy self-esteem. It's also not uncommon to hear people recall in their dreams about losing teeth. A 2018 study found that 39% of undergraduate students in university have dreamed at least once about their teeth falling out. Experts say that dreams about losing teeth may reflect a person's feeling of insecurity, inferiority, or isolation. Or it could mean that one may be undergoing a major transition in life, or getting ready to enter a new phase of life. What we've talked about so far is related to interpreting the meaning of dreams from a psychological perspective. Do dreams also have significance in the physical aspect? In contrast to psychoanalysis, which focuses on the meaning of dreams, neuroscientists examine the brain structures and functions that are responsible for dream production, organization, and narratability. Throughout the night, we constantly repeat two phases of the sleep cycle: rapid eye movement, or REM sleep, and non-REM sleep. Non-REM sleep is the first phase and contains 3 stages. We gradually transition from stage 1 to stage 3, in which our brain activity and bodily functions start to wind down. Then we enter the second phase, REM sleep, in which eye movements, breath rate, and brain activity increase. Typically, the sleep cycle will repeat 4 to 6 times, and the REM stage gets longer as the night goes on. Although dreams can occur in any sleep stage, the most vivid dreams occur during REM sleep, in which the brain is the most active. In REM sleep, our body experiences temporary paralysis to avoid physically acting out the dream. Experts believe that REM sleep serves an important function in maintaining cognitive functions, including memory, learning, and creativity. Researchers say that some of our dreams may predict our health, and the term prodromal dreams is used to describe the phenomena where a person's dreams reveal the body's condition, even before the onset of a disease. The theory suggests that all parts of our body are interconnected. When a physical or mental issue occurs or is about to occur, our brain, the command center, can detect it on a subconscious level and reflect it in a dream. If these cues about our health condition can be recognized, it would be beneficial for starting early interventions to address health issues. In an article for the magazine Psychology Today, Dr. Michelle Carr, a researcher at the University of Rochester, Sleep and Neurophysiology Laboratory in the USA, gave an example of an oncoming cold to illustrate the connection between the body and our subconsciousness. When the immune system becomes aware of the intruding virus, the body will react by initiating a series of physiological changes, such as throat inflammation, to prevent the further progression of the cold. Before obvious physical symptoms appear, one may experience a nightmare of choking and wake up feeling disturbed. The viral infection in the throat is translated to a relevant image to alert us. If such a prodromal dream is noticed early enough, preventive measures such as taking more rest or drinking more water could be taken to reduce the duration of the cold. Frequent nightmares can also indicate certain mental health issues, such as anxiety, depression, bipolar disorder, and post-traumatic stress disorder. According to a 2019 study published in the journal Proceedings of the National Academy of Sciences, people who are under stress tend to have a longer period of REM sleep, causing them to have more extensive and vivid dreams. For patients with bipolar disorder, knowing the types of dreams preceding an episode could help them predict oncoming shifts in mood. People who develop post-traumatic stress disorder could experience recurrent and atypical nightmares, which tend to be a recollection of traumatic events that constantly make them relive terrifying moments. There are plenty of other factors that can possibly affect our dreams. It is reported that drinking alcohol tends to cause and exacerbate nightmares. Discontinuation of certain medications may also increase the occurrence of nightmares. Antidepressants, for instance, suppress REM sleep. Hence, when one stops taking an antidepressant, REM sleep is no longer stifled, resulting in a rebound that extends REM sleep. There isn't a standardized way to explain dreams or use them to diagnose health status. Instead, it's more important to find an approach that best reflects your situation and guides you to solutions to problems. The bottom line is that if recurring nightmares have affected the quality of your sleep or daily life, don't hesitate to contact your physician for a further checkup to rule out possible underlying causes. We hope that today's show will help you in personal growth, including achieving better self-awareness and living a smoother life.
In happiness and suffering, in joy and grief, we should regard all creatures as we regard our own self, and should therefore refrain from inflicting upon others such injuries as would appear undesirable to us if inflicted upon ourselves. Yoga Shastra, Jainism.
Observant viewers, thank you for your company on today's program.